And with the recent death of a 16-year-old student in Santa Rosa, parents may be wondering how they should talk to their kids about tragedies like this and any others that may have heard about through their peers or on social media. Joining me now is Dr. Michael Stanton, Assistant Professor of Public Health at Cal State East Bay. So, Doctor, thanks for joining us. How should parents approach tough conversations about these tragic events?
Yeah, I mean, this is unprecedented, the time we're in right now. It's just heartbreaking, and parents are in a tough position about what to do when, these events happen. We recommend that, above all, that parents really keep a routine, because a routine of, bedtimes, of eating times, it prevents a sense of security, and it really shows the children that, you are there and you're present for them. Another thing is demonstrating how to cope, because you're also finding out about this at the same time, and you're having your own process of dealing and with the tragedy and experiencing emotions. So modeling good behavior is really important. And for older children, you really want to try to get them involved if you can, in some sort of effort, vigil, some way that they can participate and feel like they're making a difference in the community.
Yeah, definitely there. And we know kids struggle throughout the pandemic, both academically and with their mental health. As they readjust to a more normal life, should we say, how can parents help them cope with social or illness anxiety that may come up?
Mm-hmm. Yeah, I mean, parents need to pay attention to changes in children's behavior, particularly how they're interacting with their school classmates, how they complete their schoolwork. And paying attention to those changes is a good way of noticing how this news is affecting them. It really is important, though, for us to talk to our children about it, because they're getting information about it from their peers, and that information might not always be accurate. And the parents really want to be first there to really provide that truthful and helpful information that's going to make the children feel like they're protected and secure in the family.
And with social media, parents might not know what news and information their child is actually looking at, learning about, or scrolling through, and it could be affecting their mental health. What are some signs of anxiety or depression that parents could look out for, and should they monitor their social media?
I mean, depending on the age, parents should be careful about what their children are exposed to. Obviously, that has its own challenges with it, again, depending on the age of the child. But certainly an example of a child who's really anxious or depressed, or, the signs might be a little different than you might expect. So, for example, it might be irritability, acting out behavior, maybe withdrawing, not engaging, not really talking to their classmates. It could be temper tantrums. It could be that they're not doing their schoolwork like they used to. Something's happening differently. Those are some common signs that you'd be looking out for.
All right. Well, thank you very much, Dr. Michael Stanton, Assistant Professor of Public Health at Cal State East Bay. Always good information. Thank you very much.
Thank you.
Well, if you or someone you know is in a crisis, get help from this Suicide and Crisis Lifeline by calling or texting 988.